Hi, welcome to Snackable Health. We're talking about treatment disparities between men and women. Payal, talk to us about it.
Mike, there's a real treatment gap when it comes to gender, and we just have got to do better when it comes to our women. Women are, more likely to have fewer diagnostic tests. They present later with their symptoms, partly because they don't recognize them, partly because their medical team may not recognize them. And unfortunately, they get less aggressive treatments, whether it comes to medications used after a heart attack or whether it comes to procedures like angiograms and stenting. They're just not treated as aggressively. And I think we have to do better here.
I agree. And, women typically present atypically. They have some symptoms that are different and they can kind of be ignored, and that's inappropriate. The other thing is when someone comes in as a woman and is having a heart attack and those markers of a heart attack are elevated and we don't see anything on the angiogram, we say, oh, another false positive. That's not true. Just because they don't have a blockage in the main big arteries, that does not mean they don't have a blockage downstream in the little capillaries. Is that right?
So true, Mike. And somebody who does clinical research, I'm sure you'll appreciate that one of the other problems is that all of the science that informs our decision comes largely from research done in men. And so we really need to do better in terms of enriching women in our clinical trials, which are notoriously, they're just harder to recruit and put into clinical trials.
Absolutely. Now we got to encourage women. That's part of Go Red for Women. We got to encourage women to take this seriously. It's a big killer among women. If you have any symptoms, fatigue, atypical symptoms that are typical for you, get in and get help, right, Pam?
Absolutely. Time is heart muscle, and doing so early can really save a woman's life.
Exactly. Well, thanks for joining us, Pam. Thanks to all of you for joining us here today from Snackable Health.